Hi, my name's Yvette. I'm the creator of the Spectrum Pharmacist. Over the past few weeks, I've got a lot of questions in regards to taking a break from medications. So I wanted to put this together for you in regards to all things medication holidays. So a medication holiday is a deliberate and temporary suspension from a medication. This is really different from non-compliance. So it is not, whoops, I forgot to take my medication today, or I've run out and I can't get to the pharmacy for 2 days. That is not a deliberate suspension. There can be a really variable in time frame. So some people choose to have a break on weekends, and others may do it up to a month or two over holidays. When I talk about a medication holiday, I'm particularly emphasizing stimulant medications like your dexamphetamine or your lisdexamphetamine, and not those that are in the non-stimulant class. So firstly, before we go any further, if you're considering a medication holiday, it's important to discuss this with your doctor before commencing. So why do people do medication holidays? So a medication holiday can be recommended when an assessment is required and the practitioner wants to get a baseline, so non-medicated baseline. It may be that we're up to a 6-month or a yearly evaluation of how that progress is going. Or it could be to determine whether there is a need for ongoing medication. Perhaps all the other strategies that are in place now are enough to facilitate everyday life in a focused way, that there's no longer a need for that medication use. It could be to assess the current regimen. So by regimen, I mean the dose and the frequency of a prescribed medication. And for some people, it's about minimizing adverse effects. So we know that stimulant medications can cause insomnia, so that inability to fall asleep and stay asleep. And in some people, it can have implications on reduced weight. So things we need to consider. So when we're considering a medication holiday, I want you to have a think about what type of ADHD does your child or your loved one or yourself have? Is it inattentive? Is it hyperactive? Or do they have a combination of the two? Now, why do I want you to think about this? It's because the type of ADHD that that person has directly affects their executive function, their emotional dysregulation. And the reason these things are so important is that ADHD does not take holidays. So yes, during the school holidays or on weekends, kids are not required to undertake academic tasks or sit and concentrate for extended periods of time. However, will their hyperactivity increase their risk of harm? Or will their inattentive lead to poor decision making? Further, we need to think about the environment that they're going to be in. Are they going to be in new environments? Will there be crowds? What triggers are there for any other misadventure? Is there a quiet space where you're going? What people will you be spending time with? Are they familiar faces or new faces? For children, the impact on play dates if you are going there and your child is not medicated. And primarily, it is about the overall well-being of the individual. So if your person is of an age that they can verbally or written tell you how they're feeling, great, ask them, how do you feel when you're on your medication? How do you feel when you're off your medication? There are lots of great tools to be able to record behaviours, and you might be able to compare the two, which would be great interest. So the child's well-being is the primary consideration. So it includes impulse control, the perceived safety or lack thereof, the reduced ability to focus, and a heightened emotional stress. So I'm not saying that medication holidays are not possible and are not successful for some people. I just want you to be able to consider all factors, because for some people, a medication holiday can be a negative and unproductive experience. So each medication has specific characteristics in the way that it's absorbed in the body, how it's distributed, and how it's eliminated. And these are referred to as pharmacokinetics. So when we're taking a medication holiday, it's really important to consider these factors for the fact that a medication may stay in someone's system for longer than what we anticipated. So this table here outlines the 3 stimulant medications available in Australia, and it has the approximate data for the peak absorption. So after you orally take the medication, the maximum amount of that medication in your system, that time frame, the duration of action. So how long is that medication active in your body? And finally, the half-life. So the half-life is the time taken for the concentration of the medication to reduce to half of its original volume. It's this half-life that you need to consider when you're talking about a medication holiday and when it is appropriate to stop a medication. So some people may be able to abruptly stop their medication. So for example, a short-acting Ritalin, where its half-life is only 2 to 3 hours, is perfect. Within a 6-hour period, 90% of the medication has been eliminated from the body. Compare that to dexamphetamine, which has a half-life of 10 hours. So it is going to be nearly a day, and in some people longer, depending on their metabolism, of having that medication completely out of their system. Furthermore, if you are on a higher dose of your medication, you may not be able to abruptly stop it. You may need to wean it down. That means taking a smaller dose over a certain number of days. And this will be recommended by your pediatrician or your prescribing psychiatrist. So if you go ahead with a medication holiday, have a think about what strategies or the increased use of strategies you're going to need. So this might mean more cognitive behavioural therapy. So you may need to speak to your psychologist about extra techniques to help. Might be a good idea to write a social story about not taking your medication, considering the emphasis is normally we need to take our medication every day. Maybe a social story about why we're not taking it and how we might feel. If your child likes mindfulness, might need to use some more, or yoga, exercise, especially for that hyperactive ADHD. Exercise is going to be key. Having access to fidget toys and a quiet space. So all these strategies and many more are going to be required during a medication holiday. So finally, my TSP pharmacist tip, keep an eye on your prescriptions. So in Australia, stimulant medications expire after 6 months from the initial prescribing date. So not the first time you got it dispensed, from the day that you saw the doctor and they gave you the prescription. So just because you're taking a medication holiday, I don't want you to then come to recommencing your medication and find you've got none. So please, for that tip, keep an eye on your prescriptions. Thank you so much. Stay tuned, link in with me, comment, subscribe to the Spectrum Pharmacist. Thank you.